I'm Bruce Rollman, and I want to welcome everybody to our fourth annual technology conference. And I think hopefully this will be the largest and the best to date. We have a couple new innovations that I'll talk to you about that we're trying for the first time here. But I guess the first step is before we go any further, I really want to thank our organizing committee for putting the event together that we're here. Carissa, who will be speaking a little bit later, led the abstract submission contest, and there'll be posters later at lunchtime and this evening. I want to thank Dmitry Babichenko from the School of Computer Information for hosting the second Games for Health hackathon 2 weeks ago. Some of the winning student teams will be here this afternoon presenting their designs. Especially huge thank you to Julia Holber and to Amy Anderson, who spent hundreds of hours putting this event together. Just want to say thank you. Julia, if you could raise your hand in the back, and Amy. Thank you. I also want to thank our sponsors, beginning with the Office of the Vice Provost for Research, without whose generous support it would be hard to have the healthy breakfast that we had this morning. So I want to say thank you very much, and our keynote speakers. And this is, we're grateful, as well as the support from our other sponsors listed here. I also want to welcome back, we're going a little bit fast because we already started a few minutes behind, and I want to keep to the schedule today, and we have a lot going on. I also want to thank Leah Silverman, who's in the corner here. Leah is back, and she will be live drawing the conference today. And you'll be able to see her creations up close at the lunch and also at the software demo and poster receptions. Leah, thank you for being back with us. I mentioned the special thanks to Julie and to Amy again, who put in just countless hours doing all the detail work on assembling the conference, the brochure, and the interviews and everything else. I also have to acknowledge tragic events of the last week, and also the strength of our city. I'm extremely proud, but despite this tragedy, I'm very proud of the city and the elected leadership about coming together and the community coming together to fight hate. I don't know if I need to remind everyone, but tomorrow is election day. I'm not going to give a platform about who to elect or what, but just make sure that you're out to vote. It's really, really important. It's always important, but perhaps this election is even more important. A couple of the conference goals today, as in prior conferences, the goal of our conference is really to bridge silos across disciplines. I'm really delighted that we have approximately 230 people pre-registered to attend the conference. People will be coming in and out because of clinical responsibilities and teaching and so on. So please, stay for as long as you like, or leave and come back if you have to teach a class or see patients or do consults. But really the most important thing is for our conferences are bridging these silos. And as you look in the program, you'll see people from across the schools of the health sciences at Pitt, the information sciences at Pitt, the business school, Carnegie Mellon, local investor community, as well as people from outside the region. They're listed by name of some of the people who pre-registered as of about 10 days ago in the back of the program. But make sure that you introduce yourselves, exchange business cards. So it's really important just to get the most out of the conference. I see some people on their smartphones and laptops and so on, and I'd strongly encourage people, to the extent that you can, resist the urge. We all have it, but resist the urge to look up things on your phone or do email so that you're maximally engaged, since you're spending the time from your rest of your schedule to be here. The other issues with our conference are to share new ideas and knowledge. And I'm super excited by the program that we've put together on social media, on chatbots, artificial intelligence, on virtual reality, augmented reality, and I'm just super excited, and I hope that there'll be something for everybody here today. And you walk away inspired for new projects that inform your own work, keep it creative. And then finally, just have fun. So this is an overview of the schedule. We're in our morning, just starting our morning plenary, and we'll hear from Dr. Rutenbar and from Sherry Pagoto in a moment. And then there'll be another session. The plenary sessions will all be in this room. And everything is listed on the program about where everything is. But the next plenary session on chatbots and artificial intelligence for behavioral health will be in this room. And then we'll have a lunch downstairs and poster displays. We tried to have a healthy lunch, just like breakfast, no croissants and muffins and so on, but a really healthy protein and fruit to start the day. Afterwards, after lunch, we'll assemble here and around the building for the afternoon breakout sessions, and then the afternoon plenary, followed by the networking reception, software demos, and posters. It's our pleasure to welcome Dr. Sherry Pagoto, who's a director of the Center for M-Health and Social Media at the University of Connecticut, and also the current president of the Society for Behavioral Health, here at our meeting today. Sherry's presentation is sponsored by the Department of Medicine, and she'll also be giving medical grand rounds tomorrow with a different talk to the House staff and attending. So if you like what you hear today, come back tomorrow at noon to the 7th floor auditorium in Montefiore to hear Sherry again. This afternoon we have Yasser Sheikh. And Yasser is a director of Facebook Reality Labs Pittsburgh that was formerly known as Oculus. And they are located like 2 blocks away from where we're standing right now, and they're doing work with augmented reality and virtual reality, and I don't know how many people at CMU or Pitt really know about this group. And so this is part of like an introduction of Yasser's work and Facebook Reality Labs to the rest of our community. And then this afternoon, I don't know why that's green, but this afternoon we're also going to hear the winners from the Dimitri's Games for Health contest that was held 2 weeks ago. So I'm really excited to hear there were 40 teams that competed, and the top 3 will be presenting at the software demo session at 4:30 this afternoon, and also be getting awards at the afternoon plenary. And I've shown this slide before about from a Harvard Business Review article. When you're here at the meeting, in terms of making new connections, you really have to be planful. It doesn't just happen. So try to talk. We're scientists. Many of us are numeric. Some of us are engineers. It's really important to try to talk to 30 new people, exchange business cards, and then tomorrow and later this week arrange for follow-up meetings. It's good that you're here, but this is kind of like a start or an icebreaker. And I hope throughout the day at the breaks that we've scheduled plenty of these and good food, that you'll have an opportunity to meet new people, as well as to reacquaint yourself with other people that you might not have seen for a couple months or a year or so. So I mentioned having fun. So a couple things. We also have a raffle going on with this meeting. We're scientists. We like to get our sample size up. So it's really important to get the evaluations back. And as a special incentive, we're going to be having a random raffle for 3 $50 gift certificates to the cultural district that could be used for the ballet or the Benedum or the public theater or another event through there. So again, we're going to have this with turn in your forms at the end of the day or complete the evaluation online. We'll have the drawing by the end of the week. That'll be random. And finally, the last thing is our swag this year. Last year was the battery charger. This year is the tile. So I hope that you'll use it maybe with your keys, or I know I'm going to give mine to my daughter to put in her winter coat so it doesn't get lost at college. But I hope that you enjoy, and I want to thank everybody for being here. And without further ado, I want to welcome Dr. Rob Rutenbar, our Senior Vice Chancellor for Research at the University of Pittsburgh. Thank you.
Well, thank you, and good morning, everyone. I'm Rob Rutenbar. I'm the Senior Vice Chancellor for Research here at the University of Pittsburgh, and I'm delighted to welcome all of you to the 4th Integrative Conference on Technology, Social Media, and Behavioral Health. First, I'd like to thank Bruce Rollman and the Center for Behavioral Health and Smart Technology for re-inviting me to be part of this significant cross-disciplinary conference. I had the privileges of being here, like literally at this podium in this room, exactly a year ago, not very long after I arrived at the University of Pittsburgh. So a wonderful opportunity. I look forward, among other things, to seeing what my portrait looks like this year. So those of you who haven't noticed it, it's actually happening over there in the corner. So if you're a speaker, hope your left side is your good side. Right? Otherwise, you're going to have to do this a lot. Right? It's an awesome addition, a really fun thing that this conference does. So I'm super happy to see that again. First, special thanks to our keynote speakers, Dr. Sherry Pagoto from Connecticut and Dr. Yasser Sheikh from Facebook and Carnegie Mellon for sharing their time and their expertise with us. Now, in its fourth iteration, the conference gives life to the remarkable vision of its organizers, that we live in a world in which the interaction of technology and social media sways actions and opinions in many dimensions across the globe. Unfortunately, sometimes in ways that are of immense concern, but that same technology and the intersection of the technology and social media offers the potential to sway behaviors of individuals in ways that might vastly improve the state of their wellness and their health outcomes. So this is a tremendous opportunity, and the city of Pittsburgh in this conference can change the national conversation about the intersection of this technology, social media, and health behaviors because of the unique attributes of the conference and actually of the city itself as a platform to host events like this. Look, the city is a hotbed of technology innovation, and the health and biomedical communities are having an accelerating impact on innovation and translation into patient and population outcomes. The University of Pittsburgh and the leadership team have newly recommitted themselves to not only continuing the excellence of the University of Pittsburgh platform for academic research, but trying to move this stuff across the boundary into impactful clinical outcomes on people. And I'm happy to be able to sort of go to conferences like this and see all of these translational activities across the entire Pitt platform. The conference also does something really remarkable and important at this particular intersection. It brings together key players from across all of the stakeholder communities. So it brings together physicians, it brings together scientists and technologists, it brings together innovation and translation professionals, it brings together public policy experts and public health professionals. So this meeting truly integrates all of the skills and the ambitions needed for success in this incredibly important and challenging area. And so I wish you all of the best in your deliberations and your conference. And with that, I will turn it over to Bruce and I guess our keynote. Okay, thanks.
Good morning, everyone. So we're going to kick off the scientific programming with a data blitz. Thank you.
You're welcome. Just start present mode, I guess.
Okay, perfect. So we have 6 presenters lined up for you today. These are selected from the 21-22 abstracts that were submitted this year. And I think they really serve to highlight some of the innovative and multidisciplinary work that's going on in our community. So we'll have 3 presenters this morning who should move toward the front and maybe sit up here so you're ready to go. And then 3 presenters right before the afternoon plenary as well. And each presenter will have no more than 3 minutes to introduce themselves and give a quick, enticing overview of their work. We won't have any time for Q&A, so please try to connect with the speakers later throughout the day if you're interested in their work. So without further ado, let's get started with the first presenter. Abdi, if you want to come up.
Thank you. So, hello. I'll try to make this quick. My name is Abdelkareem Bedri, and I'm a PhD student at Carnegie Mellon at School of Computer Science. And today I would like to talk to you about my research in automatic diet monitoring. So diet-related diseases. We all know they're prevalent worldwide. In the United States, there are about half of the adult population that suffers at least from one or more diet-related diseases. They're mainly caused by low physical activity, poor eating behavior, and one of the most effective ways to combat and prevent diet-related diseases, well known, is journaling. It's very effective to make people aware of what they're doing, keep track of their behavior, and try to adjust it to prevent these diseases. In physical activity, it's easier to monitor these days because we have all of these gadgets like Fitbit and Apple Watches. which make it very easy for us to keep track of what we're doing. But when it comes to eating detection or eating dietary behavior, it's really difficult. We are mainly reliant on self-report. People have to actually keep track of what they're eating, take pictures, and so on. So my research goal was to actually make diet monitoring as easy as step counting. And for that, I've worked on developing multiple systems to actually keep track of what we eat throughout the day. So generally, in this area, people are trying to answer three main questions. The first being is, when are we eating? So detect exactly when we ate and the duration of that episode. What we're eating, so am I eating broccoli or a burger? It's really important to know the type of food that we're eating. And lastly is how much. So to answer these three questions, I've started developing few wearables. This is some of my previous work using existing off-the-shelf form factors like Bluetooth headsets, sport headphone, try to integrate my sensors into them. And these systems are able to actually detect when we're eating with an accuracy of 93%. And we managed to actually detect the eating episode within like 5 seconds when it starts, to enable interventions if people need to. Lastly, this is my last work that I've been doing, is try to make a system that is more socially acceptable, and it's in the form of eyeglasses, which has multiple sensors, including cameras and proximity sensors, inertia sensors, you name it. We're happy to talk more about it in the poster session. And it's able to capture images of the food that we're eating. And with that, we were able to actually accurately recognize what the type of food with 92% accuracy, and also estimate the amount with a mean error of 0.5 grams. We'll be happy to answer more questions and show you more in the poster sessions. And with that, I'll leave you. Thank you.
Hi, I'm Kristen Allen, also a PhD student at Carnegie Mellon, and I'm researching indirect identification of psychosocial risks around pregnancy. So both depression and intimate partner violence are significant risks for pregnant people and for their future children, but OB-GYN appointments are really short, and they're generally focused on physical health. Some people aren't comfortable disclosing sensitive risks in that setting. So can we supplement clinician interactions with information from self-reports? Our data comes from 300 pregnant and postpartum women, first starting with a journal-style text, and then we ask 5 mood and sleep-related questions, ending with then a depression measure, the Edinburgh Postnatal Depression Scale, and the Women's Experience with Battering Scale. So the goal is to predict depression and intimate partner violence using these indirect measures. So to do this, we apply natural language processing tools. 2 of them are topic modeling and sentiment analysis. So topic modeling constitutes clustering words that co-occur frequently into thematic groups. This is an unsupervised process that lets us know what each person is talking about. Then sentiment analysis uses dictionaries of positive and negative scores associated with each possible word, and we find average scores for each participant. Adding these data then to the multiple choice responses, we conduct lasso regression to figure out which features are most important. So here are some results. The 2 topics boxed in blue are depression, are most associated with depression. The 2 in orange are most associated with intimate partner violence. So for depression, pregnancy-related expectations, labor and delivery anticipation. For IPV, we have parental responsibilities, lack of partner support, so we see some stress there about not having help from a partner. On the lasso regression, for depression, we were finding that both sentiment and topics were informative. For partner violence, it was just topics that were informative. When we added multiple choice questions, just that 5 items, scores went significantly up. So what do we make of this? Our performance, the area under our ROC curve is about 0.8, which is comparable, so for both depression and IPV, but that's comparable to the patient health questionnaire 2-item measure for depression, which means that this is a pretty strong foundation for indirectly eliciting information about someone's risk of depression. The methods that we're discussing could also reduce the burden of direct disclosure, either for people who don't want to talk about this in-person setting, or in the 4 weeks in between doctor's appointments during pregnancy. Finally, providers might find that, that topics that we turn up as predictive of either depression or abuse could inform the way they have conversations with patients during typical checkups. So I would be happy to talk more at my poster over lunch. Thank you.
Hello. My name is Afsaneh Doryab. I'm a faculty in the HCI Institute at Carnegie Mellon. And this work is in collaboration with NNDA at the University of Washington and Carissa and my intern, Grace Cow. So what did we want to do? We know that circadian rhythms is associated with health outcomes. And we also know that mobile and wearable technology can make it possible to collect longitudinal data in the wild. So what we wanted to do was we were curious about knowing whether we could predict and whether we could model rhythmicity in human data from longitudinal passive sensing. And if we could, the question was, are these models useful for predicting readmission risk or health outcome in general? So what we did was to analyze Fitbit and smartphone data from 49 patients who were undergoing abdominal surgery. And we modeled their rhythms before surgery in hospital and after discharge. And then use the features we extracted from those models in a machine learning pipeline to predict readmission risk. So the first thing we did was to detect rhythmicity in data and looking at the differences in those rhythms in different stages. You see these graphs from a non-readmitted patient. The x-axis is the number of hours, the y-axis is the activity bouts, and the black line is the raw data, and the blue line is the modeled rhythm pattern. So before surgery, you see that this patient had a pretty regular rhythm with a pretty high amplitude and activity. During hospitalization, the rhythm pattern changes and they're a bit much lower amplitude, and then after discharge goes back to normal. Comparing to the readmitted patient, you see before surgery had, again, regular rhythm. In hospital, it was totally disrupted. And after discharge, it doesn't quite go back to normal. We observed that the majority of our patients had a 24 hours rhythm before surgery and after discharge. But most patients had a disrupted rhythm during hospitalization. And in fact, none of the readmitted patients had a 24-hour rhythm in hospital. The next thing we did was use those rhythmic features we extracted in a machine learning pipeline to predict readmission. And our model showed to outperform all of these existing approaches to measure readmission risk. So we were especially interested in the recall that we saw that after discharge and in hospital data, using those data, we could predict, we could actually identify 65% of the readmitted patients. So
we have to end and move on to our keynote, but please catch up with us on the networking reception.
thank you. Thank you.
Alrighty. Do I need to change the slides? Okay. I'm gonna let you do that.
Oh, you can do it.
Dan, okay.
Where's the mouse at?
What was that a second ago?
I have no mouse. That's not helpful. Maybe I can't, nope. Sorry, Bruce, the mouse disappeared.
You want to get out? Okay, you can check your email right now.
There we go.
There we go.
Email check over. Okay. All right. Thank you for inviting me. I'm excited to be here to talk about some of the work that I'm doing. My research has been very focused on how patients are using social media to engage online. And so the title, A Call for Science of Online Patient Engagement, is really hopefully to sort of activate people to see this as a very exciting area of research in which there are many, many questions that we could be pursuing. It's a very new area of research that I think has a lot of opportunity for us. So I wanted to kind of start off by talking about a little bit of good news here. So anybody here familiar with the term altmetric? So this is basically an impact factor sort of measure of scientific papers. And so the higher your altmetric score of a scientific paper, the more that paper has actually made its way around media and social media mentions. And so altmetric, the website, actually at the end of every year will have a list of the top papers with the highest altmetric scores. And if you take a look at the top papers, you'll see that the public is actually very fascinated with research about personal health because our research is very much reflected. Let's see if I can get it to, I have like a little, there we go. So it's kind of scrolling through the top 20 there for you, and you can see these topics include obesity, depression, alcohol use, active commuting, coffee intake. Of course, any studies about coffee end up getting a lot of play. Cardiovascular disease risk, cancer risk. So this is great news, is that the public is consuming the work that we're creating and is disproportionately interested in personal health type research of all the science that's going on. And maybe that's not a surprise that we're seeing our research floating around the social media and media circles, because we're seeing that social media use has become nearly ubiquitous these days. These are the data from the Pew showing that about 70% of adults who use the internet have at least one social media account. Obviously, we see some differences with age, although in every age group we're seeing increases in use of social media, even in the oldest age ranges. And of course, the younger folks are the more early adopters of this particular technology. But when you look at gender, you don't see such a big gap. And when you look at race, you don't see a gap. And so this is a technology that we're seeing increasing uses across most sectors of the population. And so sometimes when we think about social media use, we might think about people sort of posting mundane things, or pictures of cat videos, or pictures of their child on the first day of school, or the Halloween costumes. But actually, people are using social media in many, many different ways. And I'm particularly interested in how people are using social media around their health. And so I cut some different headlines around studies and other activities going on to kind of give you an idea of the range of ways that social media is being used. So for example, right here in the middle, there's a company called Patients Like Me. Anybody familiar with this company? It's out of Boston, and it's essentially has a social media platform for people who have a condition. So for example, if you got diagnosed with breast cancer and you wanted to connect with other people who have breast cancer, you can go on there, create a profile, and you would be able to be connected to other folks who have your condition. They're also collecting lots of patient-reported outcomes from their communities, and so they have hundreds of thousands of folks interacting online, and they have an enormous wealth of data that they're collecting, not only in terms of how patients are engaging, but also how that relates to the different outcomes and patient-reported measures. But you can see there are lots of other ways that social media is being used for health, whether it's in a clinical setting, where in Brazil they had a study that came out that showed 9 in 10 doctors actually use WhatsApp to communicate with patients, because that's the most economical way and feasible way they can have these types of interactions when patients are very far away, don't have transportation or telephones and that sort of thing. As well as studies using social media platforms to deliver interventions, to look at the spread of disease. And finally, we're seeing the social media platforms themselves getting into this space. If you go on Instagram right now and you do a search, #depression, it's going to pop up a warning to you that says something to the effect of, just to warn you of the type of images that you'll see, and feel free to click on these resources if you're feeling depressed, to learn more about how you can get help and that sort of thing. Facebook is doing this as well, giving people information when they're making certain searches, using words like suicide and that sort of thing. So lots of different ways that social media is being leveraged around health. So in my research, I've been particularly interested in this concept of peer-to-peer healthcare. So this is a term that was actually coined by Susanna Fox, who was at the Pew several years ago and then became the CIO of Department of Health and Human Services up until maybe about a year ago. So this is really the use of social media technologies by patients who want to connect with other patients who have their similar health condition. So very much along the lines of what people are doing on patients like me, but also they're using all platforms to do this type of activity. And so I'm very interested in this and trying to understand the different ways people are using it and what they're doing. What are they saying? How are they engaging and connecting? So I had an opportunity recently to meet with the patient advisory board at Patients Like Me to talk a little bit about the platform and how they're using it. And their patient advisory board is made up of group leaders, so they're patients who are very active on these platforms, and they advise the company in terms of how to improve the platforms. And there were a couple of comments that really stood out to me. First one is, doctors and health professionals are great, but that's not the only way we want to understand ourselves. So patients have this desire to sort of understand their disease and their experience of their disease that goes beyond what they're getting in the clinic. I get way more health information from patients than I do from doctors. So those of you who are physicians might feel a little squeamish about that because you don't know what sort of health information people are getting from other patients. But it does seem that there's a desire and an interest in the kind of information that they're getting from other patients. And so in terms of an area of research, I think it would be really important to sort of understand what kind of health information are they getting from other patients? What is the source of that information? And is it good information? Is it evidence-based? Or is it not? So these are really important questions that we can be studying. So actually in the New York Times back in July, there was a whole article about this concept of patients using the internet to connect with other patients. And it's not necessarily to, go and diagnose oneself, but it's really the power in sharing stories. And so maybe this is really what's driving patients to do this. And social media has given them an opportunity to do this in ways we've never been able to do before. Maybe 30 years ago we had support groups where people could get together, in the basement of a YMCA or something like that, and meet with other people who had their condition if something like that was available. But now the world is our oyster. We have the ability to connect with other people with a condition who are on the other side of the country, maybe even the other side of the world. So what are the different ways patients are engaging in peer-to-peer healthcare is a question that I've been interested in. And so I came up with kind of this graphic of the different ways they could be engaging, and studies have looked at all of these different types of ways. So this kind of goes on a continuum from very passive ways to much more active ways. So starting from very passive, patients may be just reading around health-related content in their Facebook newsfeed, for example. So maybe their friends are posting health-related content. And then if they get a little bit more involved, they might actually comment or post health-related content themselves. They might even post about their own health condition on their personal page. And maybe you've seen this on Facebook where someone announces that they've been diagnosed with something or that their family member has been diagnosed with something. Then we can move a little bit further along to the right where actually joining an online community around a health condition and engaging in that community, inviting others to join you in that community, and finally all the way to initiating an online health community, whether a Facebook group or a blog or that sort of thing. So this is kind of the range of different activities that patients may be engaging in and that we could study. So there's actually a nice tool from this website called simpler.com where you're able to find patient communities specifically on Twitter. I'll show you a little demo of how it works because it's a really neat, oops, I'm sorry, I went the wrong way. Let me go back. See if I can click my demo button. It's hard to tell exactly where it is. Okay, so basically they have the healthcare hashtag project on their website, which is a way to find health hashtags that they curate. They have over thousands and thousands of hashtags that connect to online patient communities on Twitter. And you can register a hashtag and then be able to see some of the analytics of that hashtag. You can use the search bar that they have to find relevant hashtags to a particular disease. So for example, if you are interested in breast cancer and you wanted to understand how are people using Twitter to talk about breast cancer, you could do a search, find the popular hashtags. BCSM is one of them. It stands for breast cancer social media. You can see the top influencers. It'll tell you the latest tweets on this particular topic. It gives you some great data that you can extract. You can even pull a transcript of tweets over certain time periods, and then you can look at other trending words and phrases that are happening in those conversations, so you can kind of get a sense of what people are talking about. And then they have some paid tools where you can do some more deep analytics if you'd like. So I thought I would mention that in case anybody is interested in kind of learning more about these communities on Twitter. So in addition to this idea of connecting with other patients, people are also connecting with other people around health behavior. So they don't necessarily have a condition. They are just engaging in health behavior. Anybody here use Strava? It's an app that has a social media community. So if you are a cyclist or a runner, you can report your routes and every time you've done a workout. In 2017, they had logged 28 million users riding over 4.5 billion miles. So this is a great way for people who are really active to connect. And then it's not just an American thing. We saw in India earlier this year, this is kind of neat, their Minister of Health actually started a hashtag that went viral in India. And the idea of it was kind of ice bucket challenge-ish, in that what you do is you post a short video of yourself doing some sort of exercise, like maybe 10 push-ups. And then you tweet it and you tag a friend, and that's kind of like telling them they're it. They have to do the exercise that you did and then pass it along to somebody else. And they were logging at the peak about 18,000 tweets per day in this challenge, and it was fun to kind of look at the different tweets that they had from that. So I got very interested in this. My space is in the weight loss world, and I started blogging back in 2011, and so I got on Twitter to learn what sort of conversations people were having around weight loss and to build a community for my blog, which was focused on evidence-based strategies for weight loss. And I was really struck about how many people were using Twitter to tweet about their weight loss attempts. So they would have a profile up that would say, hi, I'm a single mom, or I'm a stay-at-home mom, and I'm trying to lose 50 pounds. And their whole feed is kind of a day-to-day of how things are going in their weight loss attempts. So they might talk about their exercise, how much weight they lost this week. So we decided to survey these people to find out what this is all about. Why would they use Twitter for this? Oftentimes when people are trying to lose weight, it's kind of a private experience, but here are these people who are super public about it. And so we wondered what they were getting out of this. And so we had 100 people complete our survey. We actually tweeted it out and said, do you tweet about your weight loss journey? If so, complete the survey. They were mostly female, about 38 years old. We asked them, in this current weight loss attempt, how much weight have you lost? And the average was about 44 pounds, but there was a big range, anywhere from 0 to over 200 pounds. And the median was about 13 pounds. So these people were pretty successful along the way of losing weight. We also asked them about weight loss social support. So I was very interested in the type of social support they might have been getting from these virtual strangers on Twitter versus their own family and friends. So we had them rate how supportive these different groups of people were as it pertained to their weight loss. And interestingly, they rated their Twitter followers as significantly more supportive when it came to weight loss than their family and their friends. And then we also asked them about weight shame and had them rate their family members, their friends, and their Twitter followers in terms of how much they experience weight shame or embarrassment around their weight from those different groups of people. And interestingly, they rated their family as the biggest source of weight shame and embarrassment, and their Twitter followers as the least source of shame and embarrassment. And that might come as a surprise to you, because sometimes when we think of Twitter, we think about trolls. And so obesity is a very stigmatized condition, but interestingly, these people didn't seem to be overly affected by trolls. And maybe it's the case on social media, it's a little bit easier to sculpt your community. If there are trolls, there's a really easy way to get rid of them. There's a button that's called block, and you just click it, and that person's out of your life forever. Whereas when it comes to your family and friends, it might be a little bit more difficult to kind of extract somebody from your life in such a simple way. So maybe social media allows them to construct exactly what they need from a support perspective that they're not getting in real life relationships. I'm not sure why there's that feedback from time to time. Okay, so that got us really excited about the fact that if people are using social media around their weight loss attempts, then maybe we have some opportunities there from an intervention perspective. So there was this other company that did a survey of other types of online communities kind of in a similar way that we did, but in a broad range of communities. So what they did is they surveyed 433 people who were in online communities on these 7 different topics, anywhere from melanoma, arthritis, MS, to kind of find out what sort of tools they were using to talk about their health and to connect with other patients, and to what extent was this affecting their actual health decisions. So here's a graphic that a table that they have, and you can see that Facebook is actually the most popular channel for health community information sharing, but Twitter's on there too, as well as blogs and other types of contact. And you can see that some of the contact is actually even going offline. 75% share mainly through private means. So that's meaning like a private Facebook group or something like Patients Like Me. Although 61% were actually sharing through public means. So that's kind of like our weight loss tweeters. So that's very interesting. So they asked them this question: how important is the role that these online communities play in your health decisions? And here's the responses that they got. So people who found it at all important are depicted here. So you notice that the y-axis ends actually at 70%. So all of these numbers are quite high, with the lowest being over 80% and the highest being well over 95%. So this is very interesting that what's going on in these communities is affecting people's health decisions. So again, I think this raises the need to sort of understand what is going on in those communities and how it are affecting their health decisions. So I'm an interventionist at heart. I'm a clinical psychologist by training. I do a lot of behavioral interventions, behavioral counseling for health behavior change. And so in learning about online communities, I was interested in whether we could create our own communities and actually deliver interventions within those communities. So most online communities are just sort of patients, amorphously engaging with each other, but they're not necessarily following a feed or a program per se. So in this case, we were thinking about what if we created one that actually had a guided program. So it's not just sort of a free-for-all of engagement, but we're really sort of directing the discussion around a behavior change. So in order to do this, we need content. So when I counsel people, for example, for weight loss, I'll have this manual of content. It has handouts that we would distribute to people. We would go through different behavioral strategies. We teach people things. I can't go and post that on social media in an online community because people don't digest information that way. When you go on your Facebook, you don't look at handouts and things like that. So our first order of business in doing this was really adapting our content to something that could be social media appropriate. So for example, here's the Eat Right handout that if I were doing a weight loss group, I would hand this around and we would have a discussion about it. I don't want to post that on Facebook because no one's going to read that on Facebook. They're going to be like, what is that? And they're certainly not going to print it out. So we would take all of the sort of informational nuggets of that and turn it into posts, just like this. And we published a paper on how we did that process. So if you were interested, it's in JMIR and you can take a look at it. It does take a little bit of effort to sort of think about what are the informational nuggets in your program that you want people to have, and then how do you design it in a way that's very attractive and matches kind of what people are used to seeing in their social media feed. So I want to tell you about our proof of concept studies that we published a few years ago. The first time we tried to do this, we actually had 3 groups. So our first group was just a traditional weight loss counseling group that we did in the clinic. So how we would do this in the clinic is that we would have people come in a group, and we would do the counseling like I was saying. We would hand out handouts. I would lead the group. Every session would have a theme where we were teaching them certain skills and that sort of thing, like self-monitoring or goal setting and so on and so forth. So that was our first group. And our second group, we did that. And then we also connected people in a private way using Twitter. So they had a study Twitter account that was private, and they only followed each other and the dietitian, so that they could have these private conversations in between those weekly group visits. So if someone had a question during the week or was hitting a rough patch during the week, they could say, hey guys, I'm going to a party this Saturday night and I don't want to overeat. Does anyone have any tips for me? And then our third group, we actually got rid of the clinic visits altogether, and we just created that feed where people were actually getting the intervention within the group. So they weren't just using it as a support group, it was a guided intervention delivery group. And so this was just a proof of concept study where we wanted to see if were there any signs of kind of losing efficacy as we move things online. And we didn't really see any sign of that. In fact, our Twitter-only group actually did pretty well. It was pretty competitive with the other groups. This wasn't powered for weight loss since it was just proof of concept. But we were also encouraged that we didn't see anybody dropping out of this group. And that was a trend that we've seen in our later studies too, is that we have a kind of a low dropout rate. Because when people don't have to show up to something, they're kind of less likely to drop out because there's sort of less of a burden of participation. So now we're in the tail end of a trial where we're testing or comparing these two models, the online model where they're getting the counseling in a private group versus the traditional model where we would meet in a room and do the counseling in the clinic. We're taking it out to a full year, which is a typical time period for a full-blown lifestyle intervention. Our primary outcome is weight loss. It's a non-inferiority trial, so we're not assuming that one group would do better in terms of weight loss, but that the online wouldn't be appreciably different. Our secondary outcomes are cost and retention, and this is where we do hypothesize that the online group might be less costly and have better retention, but we'll see how that goes. So with the online group, one way cost could get tricky is because people are online all the time, it might be a little bit more of a burden for the interventionist if people are asking a lot of questions and engaging a lot, particularly if the groups are very large. So this question of cost, I think, is really important and could go either way. So hopefully within about a year or so, I'll have some outcomes on that to show you. But we've done a number of other pilot studies of this format. And one thing that we're finding that's sort of a common theme is when you do these online programs is that engagement is hugely variable. So not only our studies, but other studies on weight loss and then other studies doing this with other behavioral programs are finding the same thing, that engagement does tend to predict outcomes, but it's really variable from people hardly engaging to people engaging like crazy. But at the end of the day, engagement does predict outcomes. Now, the direction of that, we're not sure. It could be that the more you engage, the more you're getting out of it. Or it could be the better you're doing, the more you want to kind of shout it from the rooftops and tell everybody about it. So it's hard to know the direction of that relationship, but it is pretty consistent. So assuming that we want to kind of get people more engaged, we've been thinking about designing interventions that could increase engagement. So I'm going to tell you about a pilot study we did that kind of leverages this concept of super users. So these are the people who engage a lot. So they've been observed in large communities and smoking cessation, for example, where they're posting all of the time, and they're very important to that online community because they keep the conversations going and they pull engagement out of other members of the network. And so it's key to any network to kind of have these people to sort of keep things moving along. So we thought with our small groups, we won't naturally necessarily have super users. I think they were saying super users could be even just 1% of a network. And they were looking at them in networks that had thousands and thousands of people. So if we're trying to counsel people in these small groups, like what are the chances we would have so many super users? So we did this randomized pilot study to look at the feasibility of incentivizing a few people to be super users. So we randomized people to one group where 3 of them were selected to be super users, and we would pay them to post on a regular basis. And then the others were randomized just to the regular group where no one was incentivized to engage. They would just engage as they naturally would. So our super users were given these instructions. Post a status update to the group at least twice a week, ask questions, comment. And we were looking for about 9 engagements in the form of posts or comments per week, which is more than 1 a day. And they would get $25 each week for doing this over a 12-week period. And if they were kind of falling behind towards the end of the week, we'd give them a little email prompt and say, you're a little bit behind, so don't forget. And they would do it. And 100% of them actually met the criteria of engagement for every single week. In terms of what to post, we asked them, post your successes or difficulties losing weight. Like, give us a window into your journey. Tell us how it's going every day. Just like the people on Twitter who were doing, you know, they're posting every day what's going on with them. Ask questions when they come up for you. If you found an awesome recipe or you made something and you have like healthy food porn, post a picture, or you're signed up for the 5K down the street, post about it. Maybe other people will join. So these are the types of things we asked them. We actually gave this specific instructions to them. So it was a 12-week Facebook group. There were no intervention visits. Our dietitian coaches logged in twice a day to generate discussion, field questions, provide support. And then we had 2 posts each day that guided people through the evidence-based behavioral weight loss program. So what that looked like is on Mondays they would set goals, on Fridays they would weigh in, on Sundays they would follow up on goals, and then they would learn things each day in between on a different topic. And we had, you know, exercise topics, diet topics, and so on. So here's the characteristics of our participants. These studies of ours have really attracted largely white female samples, basically lots of working moms, lots of Caucasian working moms. And so it hasn't been that we've naturally attracted other types of folks. So we would have to kind of design things and do a lot more targeting if we want to have a more diverse population on this. So our first question, did our super user condition engage more than the other condition? Because the whole point of the super users is to get the whole group engaging more, and therefore they might do better with their weight loss, if it is the case that engagement drives outcomes. So here we have total engagements, and sure enough, the super user condition did have more engagement. So this is average engagement, average total engagement for participant was 194 over 12 weeks in our super user condition, compared to 117 total engagements. And engagements could be posts, comments, or likes. Interestingly, it seems like the total engagements difference was really driven by perhaps the difference in likes, because we did see a lot more likes in the super user condition, but not necessarily more posts and not necessarily more comments. I was disappointed by this because I was hoping to get more conversations going, not necessarily just hitting the like button. Not that hitting the like button is bad, but we were sort of hoping more sharing would happen. In terms of the different types of engagements, likes, in defense of likes, they were associated with more weight loss. Same with comments. Original posts, not so much. And so, like the other studies, engagements did seem to be associated with weight loss. But then how about weight loss between our 2 different groups? So here we have our 12 weeks. And again, we weren't powered for weight loss differences. You usually need much larger samples to see weight loss differences. So you can see our regular user condition compared to our super user condition. And we looked at super user condition in 2 ways, with those super users and then without those 3 super users. We had good retention across the board, which was encouraging, and kind of some similar outcomes. I don't want to overinterpret the super user condition looking a little bit better because it's not powered, but that's kind of where we're at. So what we wanted to know, though, is what did our super users post? Because remember, we gave them suggestions on what to post. But what I noticed as the study was going on is that kind of wasn't really what they were posting so much. In fact, the most popular thing that they posted was informational articles. So they would find things on the internet and then post them, as opposed to giving us a window into their weight loss journey. So I was a little bit disappointed about that. And the window into the weight loss journey kind of posts were sort of less frequent coming from them. And interestingly, when they posted informational articles, it got the least conversation going. But when they posted about their struggles, it got the most conversation going. They just didn't post that often about their struggles. So it's interesting what they chose to post and how it veered off of what they were counseled to post. So then we wondered, are there any natural super users in this group? So maybe there were people who engaged just as much as the ones we incentivized. And sure enough, there were. There were actually 6 of them, 3 in each condition. Go figure. And so they engaged at the same level in terms of posts, comments, and likes. But our natural super users actually lost more weight than our incentivized super users. So I thought that's peculiar, and it might be the case that a natural super user is that person who's shouting from the rooftops how well they're doing, and maybe it's their weight loss that is pushing the engagement, not the other way around. I don't know, but they were certainly more successful. So then we thought, well, maybe we should look at what they were posting compared to what the incentivized super users were posting. And it's totally different. So our natural super users, they were very big on posting the first 2 things, motivational messages. So they would get these memes. You know, you see these sometimes on Facebook, you know, a motivational meme. It'll have like a quote or something like that, or a picture that kind of motivates. And reporting successes, which is maybe more evidence that they were having more successes because that's what they were talking about. And then they were a little bit less likely to be reporting things like information. That wasn't very big for them compared to the incentivized super users. The incentivized super users almost seemed like they were emulating the coaches by posting informational content, whereas the natural super users weren't so much doing that. So I don't know that incentivizing is necessarily the way to go to get the kind of engagement we're hoping for. Which led us down this path even further in this engagement rabbit hole of what type of engagement matters. Because we've got these super users and they're engaging in different ways, depending on if they were incentivized or not. So what if we deep dive into the actual engagement in terms of the content of the engagement? So what we did was we took all of the comments and all of the posts in this community, in both groups, and there's almost 3,000 total, and we used thematic analysis, which is a qualitative data analysis tool that you can, methodology that you can use to sort of turn qualitative data into something quantitative. So we classified the post based on what the purpose of the post was. So I'm going to present them to you in order of how popular or how frequent we saw these posts. So the most frequently occurring post was a post of someone talking about a healthy choice they made. Next frequent post was someone just sort of acknowledging someone else's post. The next one was reporting an unhealthy choice or something that went wrong. Then the weigh-in was next popular, and then we had a Friday post where we asked people to weigh in, and we got good engagement on that. The next one was show of social support, so cheering each other on. Finally, goal setting was another post. Here's the information, or informational post. Check out this recipe. This is an interesting article about exercise, that kind of thing. Asking questions was the... Now we're starting to get to kind of less frequent types of posts, with the last 2 actually being quite infrequent, only about 1% each. And that includes off-topic conversation as well as kind of negative type of comments. And so things like this might be someone saying, this doesn't apply to me, or I don't like this recipe. So we called those negative, but again, they weren't very common. So some of these types of engagement were associated with weight loss and some were not. Does anyone want to guess one that was associated with weight loss? You can just shout it out. Any guesses? Supportive. Okay. We got one guess. So I'm going to click a button, and the ones that predicted weight loss are going to turn green, and the ones that didn't are going to turn red. And so healthy choice, acknowledgement, weigh-ins, goal setting, asking questions, and being a negative Nelly for some reason. Again, there weren't many of those, so I don't know what to make of that. I guess you had to really read something to decide you disagreed with it, so maybe they were engaged. But anyways, these were the ones that predicted weight loss, and the red ones didn't. So supportive, surprisingly. You're being like a cheerleader. That would seem to be great, but that's not predicting weight loss, and neither is posting these articles and information type things. Certainly not being off topic. And maybe unhealthy choice is a reflection of people who are having a really hard time. We took an even deeper dive into these two types of posts and found out that when people talked about their healthy choices and their goals, it was only if they talked about them in quantitative terms that they predicted weight loss. So if you set a goal that was, I'm going to exercise 3 times this week, or if your goal was worded like, I'm going to exercise more this week, it was the former that was associated with the person losing more weight, as opposed to kind of speaking more non-quantitatively about your behaviors. So we've been using this information to kind of think about what sort of engagement we want to elicit through our programs so that we can get people talking about things quantitatively and posting what we know might be more useful for them. But one of the threads that we're seeing is that sharing experience seems to be more powerful than sharing information. And we do focus groups after every one of our studies, and people will say, my number one favorite post in this group is when other participants post about how things are going with them, because it motivates me, it excites me, it makes me feel like I'm not the only one struggling, and that sort of thing. And so this is what we really want to try to pull out from people, is to get them sharing their experience and get them away from sharing information, because we're the ones sharing the information. So we want to keep them focused on what we're sharing from an informational standpoint. So this got us thinking about, so what is this information that people are sharing? And so we took a look at the sources of the information that were shared in our groups. And so here we have all of the sources. So it's kind of a really like a menagerie of things. We got some blogs, we have some news outlets, and let's see what else we have here. Magazines, things like that. We've got our South Beach diet, little fad diet action going on. I was encouraged to see things like Scientific American and PLOS blogs. I was kind of surprised. But you can see there's quite a mix of places that people are getting information to share with other people about weight loss. Not a single journal article here, huh? They're not sharing science. So if you guys aren't publishing in any of these, patients aren't hearing what you're publishing. So get into pop sugar, folks. That's got to be our goal, I guess. However, I should say that 76% of informational posts, people didn't have a source. So they were just saying something informational like, oh, here's something that works, or my brother told me, or so-and-so. So we don't even know where a lot of the content is even coming from source-wise. So what I'd like to study next is to get to the bottom of other sources when people are sharing information that isn't coming with a reference or a link or something like that, and how they're deciding on what's credible and what's not. Because this kind of stuff is coming into our group. And so some of it's evidence-based, some of it goes contrary, and so what do we do about that? So overall, we've been thinking about kind of how we can better facilitate this sharing of experience, creating a safe space for people to ask for help, to support each other, and to facilitate evidence-based content being the kind of content being shared. And so perhaps we can help participants learn about what would be evidence-based and what would not be evidence-based, so that the content they share is kind of more along the lines of what we think might be helpful. But I wanted to kind of end on talking a little bit about kind of how information sharing online is becoming finding evidence-based health information, I should say, online is becoming increasingly difficult for patients for a lot of reasons. And at first it was because we had people like Gwyneth Paltrow and Jenny McCarthy kind of coming up with crazy things, pseudoscience sort of information, but now the matters are getting even worse. So there was an article that came out in the past year in AJPH showing that there are these Twitter bots that are out there whose sole purpose is to basically create polarized discussions around vaccines. And so whether you're pro-vaccine or anti-vaccine, there are these bots that will just argue with you. And so your sense of how the information is being received is that it'll be, there'll be this hostility coming at you regardless of where you are in the debate. And they're doing this purely just to polarize and create dissonance. So the tobacco industry is doing some of this too in their own way, not necessarily to cause polarization though, but they're trying to circumvent marketing policy so they can't market tobacco to children, of course. But what they can do is create hashtags and get people who are influencers on social media to use them. So a study found that they found 124 hashtags connected to the tobacco industry that have been viewed by over 25 billion accounts. And so they're figuring out ways to kind of get their marketing out there in creative ways on social media, but it's coming from sources that people might relate to more than a tobacco company, which is super concerning. Same thing is going on with e-cigs. I don't know if you guys saw this in the New York Times. So another thing that's happening that's more kind of on the Facebook is these sort of bots and trolls actually creating Facebook pages on different topics, health included, and trying to create online patient communities with the sole purpose of giving false information to them. So one of these is actually legit, and one of these is an example of a bot or a troll kind of creating a community of nonsense. So mindful being is the first one, revolutionary self-care is the second one. Which one would you say is probably the BS one? Who wants to vote for mindful being? You just raise your hand if you think that's the BS. And how about revolutionary self-care? You can raise your hand if you think that's the BS. It's actually mindful being is the BS. It's very hard to tell though, because you're like, what? They look so similar. But if you look at the quote, now that you know it was this one, it's like a little bit creepy. It has to do with kind of unlearning what you've already learned. So you could see that maybe they're sort of prepping people to change their minds about something and listen to what they're saying instead of what people believe. So this is becoming a thing. So now we have patients maybe joining communities where they're just going to be brainwashed and give, false health information. Which is more reason why we need science to kind of study these things and how pervasive it's becoming and how it is affecting our patients who are going online, getting information, and it's affecting their health decisions. And these giant online communities where they're sharing links and things like that, all of this stuff can be injected in there and really causing harm. So even though there are many exciting uses, I think we do need to kind of understand what the harms are and what can we do as public health and health behavior researchers to counter-message and control some of this. So I just want to end on this point that studying this is super important. We need to understand how patients are consuming health information, figure out if there's ways to understand who needs help by what people are posting, and this can inform whether it's public health campaigns or behavioral interventions done online so that we can solicit meaningful evidence-based types of engagement. There are many challenges to this type of research. And so anyone who's doing social media research may be aware of these things. So accessing social media data in intact online communities is difficult or not, if not impossible. So if there is a large social media community, let's say on Facebook, around diabetes, you can't just join it and extract data from it and publish papers about that. It's a private group. You don't have access to that. So it's tricky to study the online communities. If they're on Twitter, it's a little bit different because it's all public, but a lot of this is happening privately. And from the WAGO health study, we saw that most people are actually preferring to engage privately. So how do we study this? So in some of our work, as I showed you, we were creating our own online communities, but they're small, and they may be very different than the ones that are created organically by patients online. So it's hard to sort of recreate that in the lab. And a final point around research ethics in this space is that even when data is public, people may not understand that it's being used for research. There was a paper that came out in the last year that found that the majority of Twitter users were not aware that their data was being used for health research or any sort of research. And many of them were not happy about that. Now you might say, well, it's in the terms and conditions. They should have read that. But as a researcher, we know people aren't reading the terms and conditions. So what are we doing with this data that we're taking from people who don't realize that we're taking it? Are we publishing it in our papers? Are we, printing their usernames and their content in our papers? So these are tough questions of like, where is the line and where are the ethics? Our, human studies review boards don't have guidelines specific to this type of research. So it's a bit of the Wild West, and we have to be very, very careful for that reason. So I'm going to end on that note and point to some other resources here. We are having a conference at UConn in May where we're going to be talking all about these topics. That's a whole day of things like this on all kinds of different topics, tobacco. We'll have, and obesity, physical activity. We'll be also talking about observational studies using social media research and ethics. And then finally, we have the SBM meeting where we're going to be talking a lot about how healthcare professionals and public health professionals can be using social media in ways that can properly educate patients and create good health communication. So I'm going to end on that, and I know our coffee break starts at 10:15, so maybe we have time for a few questions. There you go. Right, so I think when working with diverse populations, you want to find out what social media platforms they use and are comfortable with and are comfortable using for this purpose. So, so for example, I was involved with a study targeting Latino moms, and so as a first step, what we wanted to do was find out what platforms they're using. They preferred Facebook. And then also, do they prefer it to be in Spanish? Do they prefer it to be in English? And to make sure that you're creating it to meet their preferences. So I think some of that preliminary work is really important before diving in and just sort of seeing, oh, well, this study did it on this population. I'm going to do exactly what they did on my population, because it may not work at all. And there's a lot of differing opinions in terms of different populations of where they feel comfortable with. With some populations, may not feel comfortable at all with engaging in this way online.
This is very important, even if you are with that, that's not that good, but you have to also consider ethical behavior when you use that.
Absolutely, and so the onus is really on you to communicate how the platform works, what the privacy policies are. So when we recruit patients into these programs, we go over the privacy policies. We talk about, different privacy settings, what they can expect, what's not private, and so on and so forth, so that everybody understands. And we do the same thing to IRB so that they understand.
Sherry, thanks for
Yep.
the great talk. Do you want to talk about what you're thinking next in terms of the natural super users?
Yeah, so we were thinking, since they're out there and maybe not that hard to find, maybe what we need to do is just seed our groups with them to make sure they have enough of them. And because they seem to have the type of energy and are posting the kinds of things that might be more motivating. So that's kind of how we're thinking about it, kind of getting away from maybe incentivizing and more kind of finding people who are naturally doing that and see what sort of effect they have on other groups.
How might you see them?
Yeah.
They're sort of in the wild.
That's the million-dollar question: is how do you find a super user? Because if one way you might, are they involved in another community in which they're a super user? But then they might already be very committed to that community and not wanting to, be a super user in another community. So it's hard to define. I think we need to figure out who is a super user. Like, what are the characteristics of a super user? And what would they be comfortable with in terms of coming into a new community? Because if they're already doing that somewhere else, it may be hard for them to sort of replicate that. So it's tricky, and that's kind of where we're a little bit stuck. We're like, how do we find that person? Now, we could also have somebody pretend to be that person. That would be another way to go, like a Confederate who behaves as a natural super user. But I'm kind of less excited about that route. But Ellen?
Thank you for a great talk, Sherry. I have a question about whether you've had to wrestle with the distinction between certain behaviors on social media platforms are behaviors in their own right, but they can also be evidence of other behaviors. And so as you were talking about, for example, people who post goals in kind of quantitative specific terms had more success with weight loss than people who posted using vaguer terms. And those posts are behaviors, but if they're evidence of another, the actual behavior, we know that being more specific in goal setting is associated with better behavior change. So how are you thinking about that? And it made me wonder if even guiding people to be more, to post in different ways might affect their actual behavior outside of social media. But how are you wrestling with that? Because I found myself getting kind of confused about that, or kind of tied up in that as you were talking.
Yeah, I mean, so from kind of the intervention perspective, we want to use it in the way that you're thinking of, trying to get people to be more specific in how they articulate their goals, or at the very least, seeing it as a red flag if someone is articulating their goals in this way. And we do prompt them. So if someone said, I'm going to try to exercise more this week, what our counselor would do back to that would say, tell me more about that, like how many times, what days were you thinking? And sometimes people aren't responsive to that, like they won't be nailed down. But at least I would know as the counselor that this person, kind of the way that they're speaking is such that they may be less successful, so maybe I need to do more for them. So I think that's important. I think it would also be very interesting to have some sort of real-time behavioral measures that we could map some of their engagement data onto to kind of see how it connects to kind of more on a day-to-day basis. So are the people who are stating quantitative goals, like are they always following through? And what does that actually look like? So that would be very interesting to do, because we've only looked at it in predicting outcomes, but not actual behavior. So I think that would be cool. Maybe with some like kind of just-in-time or like EMA type methodologies.
I'm a cardiologist, and part of a group online on Twitter using this hashtag drop down and give me 20 that was started by two interventional cardiologists, and it's morphed into not only cardiologists but patients, transplant patients, along with just coronary artery disease, and it's an online community where we are posting all over the world, dropping down and doing 20 push-ups. Like I would do it here and then post it. In fact, I should, because I would put your hashtag of this conference and whoever else is on Twitter, and it's just been a great way for patient engagement, and also just getting the message that just move. You don't need anything fancy. You just drop down wherever you are, and it's just been interesting to be part of that because it's totally new and just like serendipity.
Absolutely, and I love the uses of social media around health behaviors, particularly if it's something really doable and simple. We did something similar, kind of serendipitously with planks, where we kind of started a hashtag called Plank-A-Day, and people were just sort of glomming on, and we're like, this is crazy. It was just for us, but everyone else wants to do this thing. So I think it's a great way for providers, healthcare providers, to engage with patients. It's fun. People get a big kick out of this. We actually did a study where we looked at all these different health hashtags on Twitter, and there's a ton. And they're started by all different groups. There's one, Runner's World has 2 a year, and basically what they are, one starts on Thanksgiving and it goes till January 1st, and it asks people to kind of run or walk a mile a day, at least, every single day during the holidays to kind of manage holiday weight gains, called Run Streak. And they do another one, I think, around the spring holidays. But these kinds of things, I think there's a lot of opportunity to engage people and create big communities without having to try that hard, because people love to do fun things, just like the one in India where if you look at the tweets, they're just hilarious, and people, you know, it's kind of like the ice bucket challenge, but there's actually a ton of these types of things around physical activity and other health behaviors that are going on. Maybe not to the level of ice bucket challenge, but kind of smaller versions of that. Other questions? I know I'm getting, yeah.
I have kind of a follow-up to what you were saying, so almost a question. I'm very interested as you are in daily engagement, long-term sustainability. So are you collecting any data on the daily behaviors that individuals are doing beyond what they're tweeting? You know, like self-weighing or self-monitoring or behaviors?
So we have not the ones that you're mentioning. I mean, we have kind of the usual measures of like diet and physical activity, but not on a day-to-day basis. But but I think that would be important. Yeah. Mm-hmm. Yeah. Absolutely.
I'd like to ask two questions. The first question is, who benefits from these bots that are designed? I can see for a political candidate or for smoking, someone stands to benefit, but who benefits from these bots that are just created to make disturbance? And the second question, and I had the benefit of hearing you last night talk about this. Dr. Pagoto has like over 23,000 Twitter followers, and they're organic followers. They're not people that you bought or anything like that. And then you have some advice to other people who are on Twitter, how to grow their communities.
Yeah, so in terms of who benefits, I don't know. I mean, this seems to be a political thing. I don't know if they're just trying to destroy our country and our democracy. I don't know. I'm not a political scientist, but if there's one in here, please answer this question. And why are they getting into health and all of these things? But in terms of growing an audience on social media, so that's more fun to talk about. Well, I think that number one is you want to engage on a regular basis. So something like Twitter, it's a daily thing, and then people are on there every day. It's very real time. So I think you have to be present and engage and actively follow other people. So there's definitely a reciprocal sort of environment on there where if you follow people, they'll typically follow you back. I mean, like Barack Obama doesn't follow me back, but other regular people do. And so kind of building your community of who you want that audience to be. I think it's important to not just follow like each other, but like you were saying, having patience, following patience, listening to these other groups. I think that's very, very important because I think we tend to sort of want to follow each other. And then engaging back and forth. So you don't want to just sort of be pushing content out there like, oh, hey, here's what I'm doing, everybody. But actually engaging in conversations, I think, is important to kind of keeping followers and then building other followers. So I think those are kind of the three big things is you, especially having a very proactive follow strategy, because if you just sort of have your account there and wait for people to find you, it's tough. There's a lot of people on Twitter. It's hard to find you. So you kind of have to find other people. All right, thank you. Well, I guess now is our time for our coffee break.
Thank you also.
Oh, thank you. Oh, that's very nice.
And also in our program towards the back are some hashtags if anyone wants to try to grow their own profiles here and to spread Sherry's work and her center. Sherry, we also, as I mentioned before, will be giving medical grand rounds tomorrow at noon in the 7th floor auditorium in Montefiore. She'll be speaking on a similar but different topic. And so invite everybody. There will also be a lunch there too. So we're looking forward to your presentation. Right now we're going to have a little bit of a break if people want to check their email, if they want to talk to other people, and then come back in this room. We've got 15 minutes for our session on artificial intelligence and chatbots. Thank you.